think it was during biology class in high school. I really had a interest for it, and really one of the early people who really encouraged me to go into medicine was actually my mom. So she just really thought that it'd be something that I would do well at, and that with my personality and things that it would kind of fit. And after going through medical school and becoming a doctor, I can't imagine doing anything else. Grew up in Wichita, Kansas, and went to school in Benedictine College in Atchison, Kansas. And ironically enough, they had a very big presence of St. Louis-based. I think it was about 50% of people in the school were from St. Louis area. And so I was familiar with that, and I played basketball in college, so we had times when I came to St. Louis. And always been an area that I would like to, where I saw myself being long-term. And from a very young age, my granddad was always a Cardinals fan. Even before the Kansas City teams, they had the Cardinals in the regional out presence, and so he was always interested in that, so I became a Cardinals fan, and obviously a huge Cardinals fan now. I was always interested in athletics and very athletic, played multiple sports in high school, growing up. I think that was just a natural lead-in to be able to take the musculoskeletal system and how to assist people that have injuries get back to health. And now as it's gone through my career, I also recognize the athletes as we age, and I start to have other issues, and now with arthritis, how to keep people active and maintain an active lifestyle that really is good for overall health and function. I really like taking care of people and having those interactions, and it's fun when you see somebody that comes in, they're hurting, they're having pain. You can really tell. Sometimes you can just tell by the look on their face and the pain look, and sometimes people get better with injections, medications, and they come back and 4 weeks later saying, you know what, I'm very happy and getting better. But then for the ones that you can just tell that after a while, they're like, I need to do something different, I need to have surgery. And then they come back 1 month, 2 months later, and they're starting to say, wow, this is feeling good, and I'm glad I had the surgery. And that's very rewarding. I've liked to play golf. I don't play as much as I like to. Unfortunately, the stereotype, I wish I was more like it, but I have two, children. One's a junior in college at Illinois. One's a junior in high school. I like working in the yard, seeing things grow and take shape.